Oh, yeah.
Is that working?
Let's hope it doesn't fall.
All right, Thomas.
Are y'all ready? Barbara says just a minute. Okay, Kobe, Barbara. Sure. No, I was. Your official introduction. I'm just going to let her know how it's going to go. All right, we're gonna roll. Okay. All right. Good morning. Thank you for being here early today on somewhat short notice. This is exciting. We talked about it before this started. We were out here kind of briefing about how I can't remember anything like this ever being done. This chorus of medical and healthcare leaders in our state coming together, obviously for something that's very important. Just a heads up on how this is going to go. Dr. Woodward is going to make some comments. And then each one of the representatives of these organizations are going to have come up, and they're going to make some comments on behalf of their organization. Then Dr. Alan Jones, who you all know from Ummc, he's going to come up and paint a little bit of a different picture of the state and Ummc, and get more into the hospital side of things. And then we'll open up to questions. So if you obviously hold your questions till the end, and then we'll get to them and have plenty of time to get to that. Okay? Dr. Lou Ann Woodward.
Yes.
Oops.
Thank you. Good morning and welcome to all of you. Thank you for being here. Thank you for those that traveled to join us today. As you can see, joining me today here in the chairs are key healthcare leaders in Mississippi. And we are coming together today to offer some commentary on the situation around COVID-19, as well as to express a shared sense of urgency about our current situation. We are seeing in Mississippi an increase in the number of cases. We're seeing an increase in the number of deaths. We're seeing an increase in the number of hospitalizations. And you don't have to be a healthcare professional to know that this is not good news. These are not the trends that we want to see. This is not the way that we want to see the state going. This is not the right direction. When we were first dealing with the pandemic, we saw a lot of widespread caution and concern. An early shelter-in-place order helped to slow the initial spread. As we have eased up and as we have opened up, we are seeing much more rapid spread of the virus across our state. In fact, we are having right now, our largest surge of patients. Don't get me wrong, I am not advocating for a statewide shelter-in-place order. I am convinced we cannot shelter in place through the duration of this pandemic. I am also convinced that what we're doing now is not working. It is not safe, it is not smart, and it is not effective. We went from shelter in place to really wide open. Whether it was official or not official, practically, behaviorally, we went very quickly from shelter in place to wide open. What we have got to find is the right place in that middle ground. We have got to find a way to live and conduct our business and conduct our lives and go back to school and all the things that we want to do. We've got to find the right way to live with this virus for the foreseeable future. We don't want to shut down the economy. We don't want to shut down our lives. We've got to keep things running. Nobody wants that. But what we all, everybody in this room, and I would wager that all the citizens in Mississippi do want, we want to know that if we or somebody in our family were to become injured or ill, that we could go to an emergency room and be seen, that we could get a hospital bed or a critical care bed if we needed that. We all want that confidence to know that that is available. You'll hear more about this as the time goes on, but I'll tell you right now at the medical center, we are full. Many days in the last few weeks, we have had more patients than we have had rooms, and we have been holding admitted patients in the emergency department and other places. You heard Governor Tate Reeves come out yesterday very firmly and very strongly advocating for the usage of masks, for using hand sanitizer, for washing your hands, for maintaining the appropriate social distancing. We are all here today to emphasize those points, to accentuate those points, and to put exclamation points on the end of those comments. I believe that we have got to monitor ourselves and decrease the number of gatherings of non-essential gatherings, of non-essential community activities. We are seeing increasing numbers and rising numbers of cases. Now, masks are not magic. They will not stop the spread of the virus, but they are a barrier, and they will decrease the spread. They will decrease the transmission from one person to another. I do not like to wear a mask. I do not like to wear a mask when I'm out and I need to go to the grocery store. It makes me hot. I start sweating. It messes up my lipstick. I don't like wearing one when I'm out like that. Our nurses and physicians and people taking care of patients don't enjoy wearing a mask for hours on end. But we're doing it. We're doing it for our patients. I'm doing it for my family. I'm doing it for my father, who is older. I'm doing it because I want the kids to go back to school this fall. I'm doing it because I want the businesses to stay open and our economy to get more healthy and to be open. We're doing it for all of those reasons. This issue is not about limiting anybody's right to make their own personal decisions. It is not about that. When we ask people to socially distance, when we ask people to have good hand hygiene, when we ask people to wear masks, it is not about telling somebody what they can and cannot do. But it is about how to navigate this pandemic. Things are not normal. We are in the middle of a pandemic. Things are not normal, and we cannot behave as if they are, because we're fooling ourselves. And the numbers are showing that what we're doing now is not working. So we need to quit acting like things are normal. All right. I'm going to get off of my personal soapbox for a second and let everybody else come up and have a moment to make some comments representing the organizations that we have here with us today. I'm very pleased to have all these individuals with us, and I'm going to run down the row and just let you know who they are. And I want to say, I would put all of these individuals in the category of the people who never stopped. You know, when everybody kind of went on shutdown and people were advised to stay home, these are the ones who didn't and couldn't and wouldn't stay home because they're still providing patient care and they're still doing what we need to do for the state of Mississippi. So I'm just going to go down the row, and then we'll start with Dr. Dobbs coming up to offer a few remarks. So Dr. Thomas Dobbs, our state health officer from the Mississippi State Department of Health. On the other side of him, Dr. Bill Grantham, who is the president of the Mississippi Academy of Family Physicians. On the other side of him is Dr. Clay Hayes, the president of Mississippi State Medical Association. Next, Dr. Alan Jones, assistant vice chancellor for clinical affairs here at UMC. On the other side of him, Dr. Jonathan Wilson, chief administrative officer and COVID incident manager here at UMC. Then Dr. Anita Henderson, president-elect, the American Academy of Pediatrics, Mississippi chapter. Next, Dr. Ustav Nandi, president-elect, American College of Emergency Physicians, Mississippi chapter. And at the end, Dr. Calvin Thigpen, governor, the American College of Physicians, Mississippi chapter. So we will start with you, Dr. Dobbs.
Thank you, Dr. Woodward, and I'd like to also thank UMC for the fantastic leadership and the remarkable work they've done as this, oh, keep it on. Okay, cool. Oh, I love you guys. Oh, man. All right. Oh, great. You're all the best. That kind of discipline is what it takes to stay on top of all this. So I would like to thank UMC. They've done such a phenomenal job. They're bearing such a large percentage of the burden of coronavirus as it goes through our communities. I look at the numbers of the hospitals every day and what kind of burden they're experiencing. We've had a steady increase in coronavirus cases, deaths, hospitalizations over the past several weeks, which is not a surprise. We've been talking about this, saying it's coming, and here it is. And not only is it here, it's going to get worse. Yesterday, 5 of our biggest hospitals in the state had 0 ICU beds. 0. An additional 4 had 5% or less, an additional 3 had less than 10%. Our biggest medical institutions who take care of our sickest patients have no room to take care of additional folks. Now is the time for the hospitals to have to step up and try to counter the impacts of reckless social behavior. But it's not going to be enough. There are going to be people, there are already medical harms happening now, people with adverse health outcomes because they cannot access the health care they need because they can't get to a hospital. And when I talk to my ER colleagues, I'm understanding they can't get them anywhere because there's nowhere to send them. We're sending people out of state all the time because Mississippi hospitals cannot take care of Mississippi patients. So what does that mean for the future? It's time for hospitals to activate surge plans. A surge plan on paper is not going to be worth anything. We have to make sure that we make room for additional patients in our hospitals. That's why yesterday or 2 days ago we were making sure hospitals didn't do elective procedures that require hospitalizations and elective hospitalizations. It's a financial drag on them not to be able to do that, but we cannot allow people to go untreated for coronavirus or other serious medical conditions in the situation that we're in. So expect more to come. Hospitals that are unable to accommodate COVID patients will have to go on elective diversion. They're not going to be able to do elective procedures until they can staff up and meet that surge capacity. We're going to see a lot more deaths. We're going to see additional cases. We have a pretty good number of cases we're going to be reporting today. We've seen a massive surge in testing and in testing demand. Our testing clinic over at West Street Farmers Market, we had 875 appointments yesterday. About 2 months ago, we did about 150 a day, if that kind of gives you an idea of what's going on out there. So be vigilant, wear a mask, stay apart from everybody, and just pretend like everybody has coronavirus all the time, and you'll be in a lot better shape. Thank you, Dr. Woodward. Yeah.
Well, first, Dr. Woodward, thank you for having us all here today. And thanks to all my colleagues who are at the table, but also all of our physicians and healthcare teams out there actively taking care of Mississippians right now. It's a very stressful time, certainly for everyone, as it is the public. As mentioned earlier, I'm Dr. Bill Grantham. I'm president of the Mississippi Academy of Family Physicians. I represent about 1,300 physicians, family physicians, residents, and students. We're out there trying to every day help make health better for Mississippians. And my simple ask today, and I'll be brief, is to please everyone use these masks. While they may not afford 100% protection, if we all wear them, we can slow the spread of the virus. The mask is also a symbol of me to you, that I respect you. I respect your health. It is protecting you from me more than it is protecting me just by wearing it. So please wear your masks. Social distancing is important. In the workplace, everywhere out in the community, certainly hand washing, using these hand sanitizers. Those three simple measures, masking, hand washing, and social distancing, are critical. No matter what vaccine comes, no matter what treatments we ultimately find work, those three things will still be very important in the containment of this virus. So I encourage you, please work on those three things. And again, thank you to all the colleagues for being here together today.
I echo Bill's thoughts about thanking the university for having us here. Dr. Woodward is such a special friend. Dr. Dobbs is doing a great job. And all the people here, a lot of friends here on this table, and we're all serious. And as Dr. Woodward said, this is a historic moment. And certainly, as the organization, the largest organization that represents all physicians in the state of Mississippi, the Mississippi State Medical Association wants to make sure that the call is sent out to make sure that y'all know that we need your help. Medicine is part of a team. This is a team sport, and it also includes the patients and their families. And we need your help. I mean, we're going to do everything we can to take care of patients as they come to our hospitals. And it is safe to come to the hospital to get procedures if you need them. But as of yesterday, I personally, as a cardiologist, had to cancel several elective cases because we don't have enough space to take care of people. And I don't want to have to tell somebody that we're going to have to send you somewhere else. And no physician wants to be able to have to do that. And it's super important that we follow the guidelines as mentioned and outlined by the health department. 6 feet is important. Hand washing is important. Masks are important. And it's really important that we all follow those things. This is no joke. I mean, all these people wouldn't be up here if we thought it was some sort of joke. And so it's really important. But we want you part of our team. We can't do it without you. And oftentimes, patients want to have part of the decision making. And right now, the diagnosis is our state is sick. And what we're doing now is not working. And so we're going to have to change our plan of therapy. And for us to have a good prognosis, we need your help. So thank you.
Thank you, Dr. Woodward, for having us today. I'm Dr. Anita Henderson. I'm a pediatrician in Hattiesburg and president-elect for the Mississippi chapter of the American Academy of Pediatrics. So I am here representing over 300 pediatricians, pediatric subspecialists, medical students, and residents. The pediatricians in the state want our children to be physically present in school this fall. In order for that to happen, we have to find safe and effective ways of getting them back to school. So we have about 1 month to get things under control in order for our children to get to school. We know that schools provide much more than just science, math, and reading. Our children are learning social skills, emotional development. Many of our children get 2 meals a day at schools, so schools are critical for the development of our children. We've also seen great disparities in health and great disparities in education during this pandemic. So our children who are falling behind are in a worse situation right now. So we want our kids back in school. But as everyone here has said, we need your help. Children learn from their parents. They model behavior that they see in their parents. So we need our parents and our grandparents out there wearing their masks, wearing them appropriately, so we can teach our children how to do that. Dr. Dobbs has said that masks, social distancing, hand washing, and smaller school sizes and smaller classroom situations are going to be critical for us to get back to school and to keep our kids in schools so we can safely take care of our children along with our staff. So we're asking for your help as pediatricians. We want our kids physically present in school because we know that those children will receive the services that some of them are unable to receive from distance learning. We have special needs children, special ed children who receive therapies at school that cannot happen from distance learning. Pediatricians are working with the school districts, with the Department of Education. We have over 160 different school districts who all have come up with their own plans, and we encourage them to utilize the pediatricians and family practice resources in their area. There's only one Dr. Dobbs, there's only one Dr. Byers. So we are working together with them because we want school to be successful and we want to get our kids physically present this fall. So thank you.
Thank you, Dr. Woodward. My name is Utsav Nandi, and I'm the president-elect of the Mississippi chapter of the American College of Emergency Physicians. And I'm here on behalf of all emergency care providers across the state to let you know that we are gravely concerned. While we are on the front lines of the pandemic, we also take care of a lot of other Mississippians across the state, many of whom are coming to us in the worst days of their lives. And we want to help our patients. A lot of them, after stabilization, emergency care will need hospitalizations. And I can tell you that our curve in Mississippi has not flattened. Lack of beds limits beds in the emergency department, and there's lots of waiting time for patients looking to get that care. And while I know COVID-19 is in the forefront of everyone's mind right now, other diseases have not taken a backseat during this pandemic. And we want to be there so that we can take care of our patients when they come in with emergencies, heart attacks, strokes, sepsis, trauma, other infections. And we need your help with this. Doctors, nurses, clinicians, researchers, epidemiologists are working tirelessly around the clock, but we cannot win this fight alone. Mississippi ASAP strongly supports all public health measures that you heard about today: putting a mask on, washing your hands, physical distancing, limiting non-essential gatherings. And I look to all of you as community leaders to do your part, not just to help emergency care providers, but also your community and our state. Mississippi, we are all in this together, and the only way to beat this is if you all come together. Thank you.
Hello, I'm Calvin Thigpen. I'm the governor of the Mississippi chapter of the American College of Physicians. Our organization has 163,000 members across the country, and I represent a little over 900 members. Those are medical students, residents, internal medicine subspecialty fellows, and then practicing internists here in the state of Mississippi. So a lot of our organization's efforts during the pandemic have been around keeping outpatient practices open. And a big part of that is controlling the spread of COVID. As you can imagine, and you all know, when the pandemic started, a lot of outpatient practices basically stopped and then had to shift to telemedicine. And then now we're starting to try to get back to in-person care where we feel like we can provide the best care. But to be able to do that long term, the spread of the virus certainly has to be controlled. So like a lot of others have said already, one of the big focuses is about mitigation efforts that we can engage in. Social distancing, hand washing, not touching our faces, wearing masks. Our organization has put out recommendations about masks and mask policies, and that they should be based on local demographics, the risk of the local population, local epidemiologic data, and also the exposure context. So I think that's already been well described, very well up here. There's no specific wording about mask mandates from our organization, but based on those three things, our organization certainly recommends following whatever the public authorities recommend. So certainly we hope that over the coming months, the virus can be brought under better control. We can get back to taking care also of all the other medical problems that just don't stop, or the issues that are really important to everybody, certainly in our state. I think everybody is aware of that, and this has had a big impact on that. So we certainly stand in support with all the other organizations here in those efforts to mitigate the spread of the disease. Thanks.
Appreciate everybody being here. My name is Alan Jones. I've helped the medical center prepare on the clinical side for what is upon us now. I've talked to you before a little bit about what our preparations were, and during that time we kind of saw a storm off in the distance a bit, and as of today we feel like we're right in the eye of the storm. You can see from some of these charts, and I think Mark's going to put them up on the bigger screen, but our statewide hospitalizations are at the highest that they've been. Our hospitalizations in our hospital hit the max number that they've been yesterday, with 91 confirmed patients and 103 total, including PUIs. And what you can see from these graphs is they're all going the wrong direction. We want them to either be flat or we want them to be going down. At the hospital, we have been here from the beginning through the end of this, up until today. We hadn't taken a day off. We feel like we've done our part, and we continue to do our part. And what we want, like many people have said, is when you present to a healthcare provider, we want to give you the care that you need. If we continue to see this trend increase, we won't be able to do that. Here at UMC, we've already had to not accept transfers of COVID patients. We've had to not accept transfers of other types of patients, trauma patients, heart patients, stroke patients. I worked in the emergency department on Tuesday. I had 2 rooms to see people in. And this is in an ER that sees 200 patients a day or more. I was woken up by a phone call yesterday morning at 4 a.m. because we had so many patients at our hospital, we didn't know where else to put them. And it's not all COVID, but a lot of it's COVID. And that COVID makes it much more complex for us to care for the things that we have to care for. And we're the only hospital in the state that cares for major trauma. We're the only hospital in the state that cares for transplant patients. We're the only hospital in the state that does certain types of procedures like LVADs. These are not things that are elective. These are things that save lives. And if we continue to see this trajectory, we won't be able to do those things. We'll be overrun. And so from a hospital perspective, we've done our part. We continue to do our part. But we need community leaders. We need the public to stand up, stand in line with us, and do their part. Or we won't be able to do what you need us to do. So our people are tired, our resources are stretched thin, but we're not going anywhere. So help us stay here and take care of you. If we can't get more support for easing back on some of these things, and allowing some more restrictions, then you're not going to be able to get the care you need, and not in the time that you need it. And that's just the stark reality of what everybody's trying to say here. So I'll stop with that, and I know Dr. Woodward's coming back up.
Thank you all for your comments. I think that it is very easy to see and hear that there's a common theme. And we're not just speaking for the people that are sitting here at this table and at this panel. We are speaking for the healthcare workforce in the state of Mississippi. And we are begging and we are asking for the people in Mississippi to get on board with us and stop acting like everything is normal. It's not. We are in a pandemic. We are still in the middle, just like he said, of this storm. It's not over. So let me just stop, and at this point in time, we are happy to take questions. Any questions that you have, I think we've got a group of people here that would be well equipped to answer your questions. So I'll ask Mark Roth to.
I'll bring the microphone to you, so if you raise your hand, I'll bring it to you. You can answer the question on the microphone so that you can hear it. I'll spray your hands.
If I could interrupt just a little bit, and maybe we can't quite hear you, especially for, yes, thank you. I'm sorry, thank you.
Dr. Henderson, 1 month is a very short time to get people prepared, and I know numbers are rising very quickly. Do you think that 1 month is a realistic goal to get children back into school? So yes, 1 month is a very short period of time in order to slow that curve and lower the curve. I will obviously defer to Dr. Dobbs in terms of what would and would not be allowed. Each school district is making their own decision, and we know throughout the whole state of Mississippi that there are certain areas that are hot pockets. So based on community spread, our goal as pediatricians is to have kids in school physically. However, we have to look at what is happening in the community before we can get kids and teachers back into the classroom. So I would defer to Dr. Dobbs for the rest of that answer.
Thank you. And just, part of it's getting to school, part of it's staying in school. So there's not going to be any school if there are outbreaks. Folks have been really kind of aggressive about getting back to football. Well, how are you going to have football when your whole offensive line's on quarantine? So it's not just about getting there, it's about staying there. And all of this is a long-term thing, right? There was this mythical theory in people's minds that was never expressed, that we're going to shut it down for 3 weeks and then everything's going to be normal. We sacrificed a lot in those 3 weeks, and we have given it all back and then some. We can educate kids safely. We can have kids have a good developmental experience and get those things they need in school, but we can't do it if we are living in a society of reckless abandon, where it's more important to go to a bar and violate the rules than it is to have our kids go to school, our hospitals be able to take care of us, and all these other essential things, and our businesses to thrive. There's nothing worse than business than having to shut down because of coronavirus. And I'm utterly frustrated by our inability to follow some very simple things and to believe crazy conspiracy nonsense as an excuse not to do the right thing. Anyway, sorry. Thank you.
And the other comment I would make is we're seeing numbers going up right now. These are not from people who got infected yesterday. These are from people who had some exposure to the virus couple of weeks ago. So we all need to anticipate and realize that in another couple of weeks, when we see the impact of the 4th of July, our numbers will be worse. We need to be prepared for that reality. Other questions?
This is another question for Dr. Dobbs. I wanted to confirm something you said when you first spoke, and I believe you said the 5 largest hospitals in the state don't have hospital bed space, and you said that they're sending patients, basically, some places are sending patients out of state. But aren't other states doing this crisis as well? Is there a kind of a saturation point that's going on?
5 of our major medical centers have 0 beds. And UMC is not one of those. I think y'all have 1 bed. Or ICU beds, that is. So Mississippi has a pretty lean healthcare environment anyway. On a good day throughout the year, hospitals will be full and ICUs will be full. So we don't have a lot of excess resources. But the other thing is, coronavirus is really bad in Mississippi. We're worse than our neighbors. We're way worse than our neighbors. We're number 5 in the country per capita for coronavirus. And so, yes, we have it bad and we have less resources, and that's a perfect storm. But we're also, I know, talking to my wife, she had somebody who needed to transfer, and she couldn't even get into Birmingham. She had to send them to New Orleans. We're having to send people all over the place. And so sometimes it's tight even out of state, but mostly we have those factors involved. Yeah, thanks.
And as you heard some people say, we don't want to send patients away. We don't want to send patients out of state. We don't want to, from the medical center standpoint, to turn away patients. There have been days in the last couple of weeks when we have had up to 40-something more patients than we had rooms to put them in. Next question.
Is the drug remdesivir, excuse my pronunciation, that's not correct, is that something that's being used in Mississippi at this point? Is that something healthcare facilities have access to, and is it helping patients?
So I'm going to ask Dr. Jones to come join me for more detail on this answer. But yes, we are using that here as part of a clinical trial. We have about 14, 15 clinical trials currently ongoing with a number of different treatment modality options depending on the patient's situation and how they are doing. Remdesivir, you did a great job saying the name, is one of those treatment options and one of our clinical trial protocols.
Remdesivir, we do have a trial going on. We also have been allocated remdesivir through HHS. We've given about 1,200 doses so far of remdesivir. Recently, the health department was receiving the shipments. That's now transitioned to HHS allocating that to hospitals and hotspots around the country, and it's transitioned from a free program to a pay program. It is not a magic bullet for this. You know, we have patients that are on remdesivir that are still in our ICUs, today. We do think it is helpful, but it's not a cure.
Okay, I have a question to get you from Jackson Free Press, and kind of a follow-up to the earlier question. He wants to know with regard to students going back to class, not just K-12, but also in college across Mississippi. What kind of metrics are going to be necessary to really kind of make a decision on what's going to happen as far as school returning? And also, how do you manage social distancing through that process? So I don't know if that's...
So Dr. Dobbs, Dr. Henderson, would y'all, either one of you care to speak to perhaps K through 12 and then maybe colleges?
We can start. So, as you know, in Mississippi, every school district has a lot of autonomy. We've been working closely with the Department of Education and the districts trying to find the best pathways forward. They're developing their plans. We've been giving them recommendations on what can be done safely and to try to find mitigation steps for things that they're prioritizing. So we're working closely with them. It's not going to be a one-size mandate for the whole state. It's just not, that's just not the way that we are designed. I would encourage for parents to let their district leaders know what they want. I think sometimes people, they presume to know what parents want. So it's good for that information to go. It's going to be touch and go all the way, right up until we get there. The CDC has guidance. We have guidelines. We're helping them to figure out how to do things most safely. And as far as maintaining social distance, a lot of that's going to be determining what you're willing to do and what you're not willing to do. In a classroom, especially setting where you can space kids out and monitor children, that's going to be pretty safe. But sort of free-for-all activity and some of the extracurriculars are going to be a little bit more difficult. And then we're trying to help them work through those questions. And then on the college piece, it's kind of similar. We're not nearly as worried about kids sitting in classroom, even if they can't get a full 6 feet apart and wearing masks. You know, those are sorts of things. I think that's pretty good. We're working on contact tracing plans with them and everything. But it makes no difference if 500 of them go to a bonfire or a big party like we've been seeing. That just destroys any sort of benefit you get from the social distancing in the academic setting. And that's going to be a real challenge.
So some of the things we've talked about and the school districts have talked about in terms of social distancing and protecting our students and our teachers are keeping kids in classrooms, moving children throughout the school, limiting lunchroom sizes, having different times of the day where students will go into the lunchroom, or in some situations having lunches brought to those particular classes. Especially with younger children, we know that outdoor activities are much better than indoor activities. So having kids outside in some situations with classes is definitely better than having them inside. Using doors, keeping doors open in terms of lowering the risk of touch. That's another mandate that Dr. Dobbs and the health department have encouraged in terms of the schools. So there are lots of different things on the schools that we can do to help lower the risk. We know there's going to be risk. We know children are going to get sick. But our goal is to mitigate that risk in order to educate them as safely and effectively as possible.
So we've had a couple of questions that have come in through text and other communications, and I'll pose this one to Dr. Hayes, and it pertains to the impact that occurs in physicians and healthcare providers' practices when in fact we have to either shut down or we have to scale things back and not allow elective procedures and things to be done. So it's a financial and an emotional impact, and if you would make a few comments about that.
Sure, absolutely. So I'm in private practice, and when we had to scale back, we had to change our practice. Now we did a lot of things we thought were helpful, like telemedicine. We're trying to do those things and still being creative about what we do, but it still impacts the way that we practice medicine. And initially, you know, when we weren't seeing patients in the office, we had to consider laying people off from work. We have 150 people in our practice, and we had to cut back work hours. And that was a problem. And the hospital's the same way. When we started cutting back elective procedures, we had a lot of staff that we had to send home, and we had to think about layoffs and things like that. Now, fortunately, we were able to recover. The federal government and the state governments tried to help us, and we made it over the first hump. But if we have more and more and more humps, how many more can we survive? And that's a really big problem. And these are, as people have been concerned about the economy, this is very much a part of the discussion. And so that's why we're making that plea out to a lot of people to just try to follow the basic rules. Because if we already have the fewest number of healthcare providers in the country as a state, and if we start having people that we haven't lay off, that means even fewer people to take care of the folks that come in. So that's a really hard problem. Thank you for the question.
Thank you. And Dr. Thigpen, would you have anything to add to that, just from the standpoint of a broad scope of medical specialties? You might speak to your own specialty.
Sure, yeah. And so I practice general internal medicine here at the university, and I'm also the residency program director, internal medicine residency program director, and we certainly had a tremendous impact from the virus when the pandemic began, when we suspended our clinic activity for a couple of weeks and then restarted telemedicine. One of the biggest impacts was on our trainees, our residents, who are, they have 3 years to prepare for independent practice and missed out on a huge swath of outpatient clinic time that they could do in person, which of course is important for anyone who's going into the practice of internal medicine. And then as far as all the subspecialties go in internal medicine, you can just imagine, especially when you think about how many immunosuppressed patients that we take care of. Hematology and oncology might come to mind first, but there's also nephrology patients who've had renal transplants, and Dr. Hayes practices cardiology. There's heart transplant patients. It's very difficult to see those patients in person when the risk is really high, then potentially get infected from being out in public. So anything that we can do to slow the spread of the virus, try to reduce the prevalence of active infections in the community is going to help all of those patients. It's going to allow us to see them in person, which is so much easier, so much better. A lot of our patients struggle with telemedicine. You have to have a good internet connection. You have to be able to manage a smartphone or a laptop very well. And you can imagine just about anywhere in the country there will be challenges there, but here in Mississippi, I think there might be more challenges along those lines. So that also is one of those factors that doesn't immediately pop to mind when people think about needing to slow down the spread of the virus, but it is very important for internal medicine.
Thank you. Thank you.
How does staffing play into all of this? What is the needs of Mississippi hospitals in having nurses and doctors to treat patients?
So I'll make a few comments about that, and then I'll just open it up if there's anybody else that would like to add to it. The question was, how does staffing play into this, the nurses and the doctors that are taking care of the patients? So one of the things that you have to understand, as you have heard a lot of us say, is all of the regular illnesses and injuries that happen all the time are still occurring. And so we've got to take care of the COVID-19 patients on top of what we're already doing. And those patients require a different level and a different standard of care from the standpoint of the PPE that is required and the intensity of the care that is required. So it is very taxing on the medical professionals that are taking care of these patients. You cannot just pop in and out of a room for a quick minute and check on somebody. The donning and doffing of the PPE that's required to decrease the spread of the virus. And we've done a good job of that. As a medical profession group across the state, we have done a good job of creating a safe work environment. I would say north of 90 to 95% of the spread of this virus is happening in community settings. But the work that goes into creating that very safe work environment is difficult, it's challenging, it is tiring. Taking care of one of these patients is more labor intensive than taking care of patients who are not COVID patients. Next question. Did anybody want to add to that? I'm sorry.
Yeah, I'd like to answer that question as well, because one of the things we've done as a medical community, the governor tasked us with the medical advisory committee, and we've had many of the folks who are in this room part of that. And so based on the good work of our health department, we already had in place a heart attack, stroke, and trauma system of care. And so we've developed basically a COVID system of care where we can flex people into different positions. Now, as Dr. Woodward said, that puts a lot of stress on not only physicians, but also other members of the workforce, medical transport folks, EMTs, nursing, lab staff. And we're often having to think about platooning work, because if the first person gets sick, then we got to have somebody follow up behind them. Well, that gets fatiguing. And that's a really hard problem. And the same thing with systems like dialysis, or all the folks that are taking care of the patients in nursing homes. We're having to think about all these things, and we're flexing where we need to flex, but we're running out of options. And that's why we keep going back to asking for the public's help on this.
I have a question. Courtney and Jackson texted me a question. Dr. Woodward, if you would clarify your stance on masks. You said you weren't necessarily in favor of mask mandate, but if you could clarify that.
So, and my stance on masks, the question was if I would clarify my stance on masks. I firmly believe that everybody should be wearing the mask. I firmly believe that. Do I want us to have mandates to wear masks? Of course not. I just like every other person in Mississippi and probably the country, you don't appreciate anybody mandating anything. You know, you want to make your own decisions. So I believe everybody should wear masks. However, if that is what it takes for the people in this state to realize that we are serious and that this is a major safety issue, then I support a mandate. I would love for the people in Mississippi to do the right thing, to wear the mask and to do the safe and the smart thing on their own. And because they're hearing from all of these medical professionals that it is the best thing that we can do to create a safe environment. But if that's what it takes, that's what it takes. So my stance would be, I don't support an overall mandate on masks unless that's what it takes to make it happen. Is that nebulous enough, or is that, I mean, I think I said the same thing 3 times. So also the question came through, and I'm going to ask Dr. Wilson to speak to this. He is our incident commander here at the Medical Center for our COVID response, and also manages a lot of our statewide disaster response activity as well. And the question has come up several times in our own conversations and over the last little while as we have watched the weather and we're moving into hurricane season. So what are the plans? What will we do if on top of what's happening right now, the numbers that you've seen, we have a hurricane here in the Gulf and in Mississippi?
Thank you, Dr. Woodward. So very timely question, since we're in the thick of hurricane season now. We actually had a discussion yesterday with our colleagues at the State Department of Health in a tabletop exercise to go through a scenario of a major hurricane impact on the state with COVID-19. We have already taken steps to give additional equipment and supplies to some of our first responders that would go into the disaster area to do triage and stabilization of patients. But the problem really lies in general population shelters when we have to maintain social distancing, medical shelters when we have patients that come out of nursing homes and long-term care facilities, and then really echoing the points that have been made today, hospital capacity is already taxed. You can only surge up to a certain point, and then you're surging into the parking lot where you're going to start taking care of patients. And that's really the scenario we would be looking at if these trends continue and we have a major hurricane. There are not enough resources in the state of Mississippi or the neighboring states to manage a major impact already on top of COVID-19. That's just the stark reality of where we are. And the one other point that I would echo on the question about clarifying on the mask mandate, I think we don't need to get too focused just on masks. Sometimes wearing a mask is polarizing, and we need to find the middle ground of everybody being smart, good hand hygiene, cough etiquette, socially distanced, and wearing a mask. It's just one component of the equation for the solution to slow the spread of this disease. Thank you.
And Dr. Nandi, would you add on to that a little bit from the standpoint of the reality of the capacity in the emergency department?
And as emergency providers, we are used to unusual circumstances and making decisions quickly. But like Dr. Jones mentioned, we are exhausted. We are working harder than we have done before. And taking care of regular patients along with patients who have symptoms of COVID, and add on top of the fact that a lot of patients may be asymptomatic and you discover they have COVID. As providers, we're not only worried about taking care of those patients, but hey, is it possible that we might be transmitting COVID to other patients? So you have to take the same kind of precautions every time, regardless of the kind of patient that you see, because you do not know who has COVID. Donning and doffing for every patient, we do it, is the right thing to do. Wearing masks while we're on shifts, 8-hour, 10-hour, 12-hour shifts, we all do it, even though it's uncomfortable. And not just these cloth masks or surgical masks, but even respirators. And on top of that, when you don't have rooms to take care of patients, it's disheartening. Dr. Jones mentioned the condition at university when you have 2 to 4 rooms to take care of patients in the emergency department because all other rooms are filled with patients who are admitted. That is not the way we want to work. We want to be there for our community. We want to be able to take care of them when they come in, and we want to have places so that we can admit them to our intensive care colleagues so that they can continue taking care of them. And it's the same thing for trainees. Dr. Thigpen mentioned we have a lot of residents over here. We want to provide them the best education so that they can get trained. They don't have the capacity to provide the care. It's taxing on them too. And it has been mentioned multiple times before, while not a lot of our patients are COVID-19, many of them are. So please, I would echo again what has been said multiple times before. Do the things that are right for you and your community. Don't get to the point where someone else is telling you do it because it's the right thing to do. Thank you.
Any other questions? Yes.
This actually is kind of open question. Just looking for some clarification as well. You said masks is only one part. I totally understand that. But as far as wearing masks for people who have underlying conditions, and you said people who have other health issues who not consider them breathing and things like that, how can they also stay safe and continue to not have this as a revolving door?
First of all, as Dr. Woodward said, masks are not everybody's favorite thing to do, right? I mean, I don't like wearing a mask either, and I'm used to it. But that being said, if you feel like you have a medical condition that would prohibit you from wearing a mask for whatever reason, you have a breathing condition, you have anxiety, whatever, then stay at home. Stay at home, stay away from people, because you are doing a couple of things. Number one, you're putting yourself at more risk. And if you have an underlying health condition, likely you're at higher risk anyway. And number two, you don't know if you have it, and you're giving it to somebody else. So it works both ways. Masks are not the panacea of stopping the spread of this disease. I feel like we walked from totally closed down to totally wide open through these phases. We just blew through them. What we need to do is we need to back up into a different phase of what we walked through, and just everybody realize that masks is one component. Masks are important, but there are multiple other components of this. Staying away from people, not having parties, kids not going to the Pearl River on a sandbar and spreading it around to everybody. We all know of all these things that have occurred. And you'll hear people say, well, the death rate is not going up. Well, the death rate is going up. Look at the numbers the last couple of days. And in the next week, we're going to see it continue to shoot up. And I hear people say, well, this is just a bad flu. Come with me up to the ICU and I'll show you some 25-year-olds suffocating on their own secretions. And then you tell me it's just a bad flu. This is not a joke. This is bad stuff, and nobody wants it. But if we don't do the things that we need to do, we're not going to be able to take care of you, and everybody's going to have it. And it's going to be a New York situation, and we're going to be in the parking lot trying to take care of people, and we can't do it. And if a hurricane hits, I'm quitting. I mean, there's no way we can do this.
Okay, you're going to have to leave the podium now, because no quitting allowed. No quitting allowed. Do we have any more questions?
I have a couple. Alan, you and Dr. Kyle's get the best parts. So I need you, before
Now, I will say, keep in mind, schools have been preparing for this for a long time. They're not just starting; they've been putting their plans together. I've been meeting with all the superintendents, and this has been going on for months already. It's just the situation's worse now than it was before. There are options for online and hybrid learning and that sort of stuff. Certainly understand the real benefit of in-person. So there's a lot of things that can happen to do it more safely, but it's fluid, and we can't. We could control it if we chose to, but it's probably going to just continue to get worse as we go into it. So there will have to be some adjustment for reality. But there has been extensive planning going on already. Schools have a lot of plans in place already. There are detailed decision guides as far as how to do things safely. Every school is different. So there's been a lot happening. There's going to be a lot of variability from district to district. That's just the way our system is. And be involved, and really excited to have AAP really a strong partner in this process. Yeah.
All right. Cody's going to wrap this up.
Okay, last question.
So I've heard that some emergency rooms in Mississippi are having to hold patients overnight, and because of these hospitalizations, what threat does that pose to the state's emergency care system?
So I'll make some comments about that, and then we have other emergency medicine folks here that can also add to it. The question is, when the emergency rooms are full or the hospitals are full and you're trying to admit patients and you can't get them to a bed and you're having to hold them in the ED, did I accurately represent your question? So, and what threat does that pose? So the biggest challenge that poses is it fills up your emergency department so that you are unable to then get your other patients in and out. The patients, as an emergency medicine physician, the patient that you're always the most worried about is the one in the waiting room that hasn't been taken care of yet, and you don't know what's going on with that patient who's waiting. So it increases the wait time for people. It increases your ability to turn over rooms and to decrease the volume of the patients that you're seeing. And it ties up your nursing staff trying to take care of patients that are basically now inpatients and have inpatient orders and a lot of things that need to be done with them, and that distracts them from their ability to put their full attention on the patients that are in the emergency department. So it's a patient flow issue, and it's an ability to continue to see the volume of the patients that you want to see and that you want to take care of. You're worried about the man that's sitting out in the waiting room with some complaint that hasn't been seen yet. All right, I think.
Any other comments on that topic? Okay. All righty. That's going to wrap us up. Thank you very much, everybody, for coming. If you need to do a one-on-one interview, we can try and facilitate that. It's been a little longer than expected. But certainly appreciate you coming. Our media partners, I think so far since this thing has kicked off in Mississippi, I think you've done an excellent job in helping get out accurate and timely information. I definitely hope that you go back to your newsrooms and really ask that we stick to verified sources for information and not just share things that are clickbait. So let's focus on that if we can, please.
And I'd just like to add a thank you to the media that's here, because we have been here now a little bit over an hour. I appreciate your time and attention and interest, and definitely thank you to the folks that are here joining me today and the time that they have dedicated to getting this message out. Hopefully that underscores to everybody how critically important we all feel that this is. Thank you.
Thank you.
Awesome.
Good stuff.
Well, that's the reason why I talked to David there and his chief labor counsel last night. I said, he goes, what time? He said, I kind of heard a rumor about this. And I said, it's at 9 o'clock. Just want to give you a heads up because, it's no problem.
Hopefully it will be a support.
Yeah.
Yeah, and also
Yeah, that's exactly what the idea is behind this.
Thank you.
Good.
Thank you both
Thanks,
for being
Luann.
here. Good to see you.
All right. Thanks so much. It's been on a good program. I'm John.
Project.
Thank you. That was great. Thank you.
They showed up, they were supposed to have 2 tables. They only had
Hi. Yeah, this is for Melanie for something else.
Right there,
Yeah.
come on, go. I have the corner right here. All right, and you can just, hey, come on this way, look down, people
Tell me
facing
where
me.
you
There you go.
Yeah.
Right here?
I am rolling.
So I've got a couple questions
Okay.
from one of our anchors. She was asking what if you could speak to some of the mental health for children when it comes to going through a pandemic.
Right. So we are very concerned about our children right now going through things like anxiety. They've been away from their friends. They're a little unsure about what's going on. So the best thing parents can do will be obviously to talk to their children and mainly listen, ask open-ended questions so they can see what information their children know, and then they can fill in the gaps. In terms of getting ready for school to start in about a month, I would encourage parents to start getting their children to practice wearing masks. There are lots of different masks out there right now.